Good morning. I am Robert Fox. I am a rheumatologist in San Diego, California. I bring my greetings to the patients of Taiwan from our Sjogren's patients in the United States. Also, I would like to outline several basic principles of treatment that you as patients will allow yourselves to help the doctor help you. The first part of Sjogren's treatment is dryness of the eyes and mouth. There are several tricks that we have learned that patients should recognize. The first is that the environment with strong winds or dry areas, such as office buildings, which are highly air conditioned, may lead to increased evaporation of the tear film. Many patients now work during the day at a computer screen, and we know that when you look at a computer screen, your normal blink rate drops by 90%. So even if you have diminished tears, they will not be spread as efficiently. So we simply remind patients to set a timer, and then at breaks such as 1 hour, to take off your glasses and rub the eye. When you take off the glasses and rub the eye, what you are really doing is stimulating the minor glands of the eyelid to make more tears. Another precaution that we have found is if you go to surgery, the operating room is an environment with very low humidity. So we always ask the patient to bring with them their artificial tears and their ocular lubricants, because they may not readily be available on the hospital formulary, particularly if you are a first case in the morning. So what we also ask the nurses and the doctors or the patient's family to recognize is that in the post-op recovery room, when the patient is just waking up, it is quite common that they will blow oxygen over the patient's face and nose. But at this time, the patient is not fully awake, and they have a very high chance to get a corneal abrasion. So we urge the patients to use the ocular lubricant before the surgery and after the surgery. We also have other suggestions that we give the doctors and the patients for the anesthesiologists to avoid using medications that will increase your dryness. Dryness of the mouth is also an extremely important problem, and it is much more than simply dryness. On the one hand, it interferes with your ability to eat the same foods as other friends eat. It makes it often difficult to swallow. It accelerates dental decay. And again, if we go back to surgery, remember that you must tell the anesthesiologist, if they intubate the patient, special care for the teeth, because you don't want to have any damage to the teeth, which already may have some decay. Now, there are artificial tears, and they differ in the kind of preservative they have and in how long they last. So when you put a tear in, if it burns, it may be the preservative. And if you're going to use an artificial tear more than 4 times a day, then we recommend a preservative-free tear. But the choice of tears is very much an individual choice. But if you are putting tears in 4 times a day and your eyes still burn, then it clearly is not simply a matter of moisture. Then we look for a low-grade infection of the lower lids called Blepharitis, which is very easily treated by gently massaging the eyelids. And again, your physician can give you instructions for Blepharitis. So be aware that when the eye continues to be painful despite using the tears, to look for another cause. In the same way, a dry mouth is not necessarily a painful mouth. Often when a patient has had an antibiotic, they may develop a low-grade oral yeast infection. Now, it is important to recognize several features. The first is that most physicians are used to a condition called thrush. This is what they get in patients with chemotherapy or leukemia. It is a different condition. This is a very obvious white, fluffy infiltrate in the mouth. And this is what we learn in medical school. But in patients with dryness, there is a low-grade form of thrush, which is called erythemitis. Now, this is often seen, and you will know, if you develop cracks in the edge of your mouth. The medical term for this is angular cheilitis. Also, when perhaps your husband or your friend looks at the roof of your mouth, there are little red dots. These are called petechiae, and these are another manifestation for the oral for the oral erythemitis candidiasis. It is very important for the patient with dentures to remove the dentures to look. Again, as patients have dryness, the dentures may move. This area of irritation may lead to roughening of the mouth where the oral candidiasis can take hold. So you must, when you take out your dentures at night, treat the dentures by soaking them in an appropriate manner, because you may cure the oral candida in your mouth, but if you put the denture back in, which still has infection, you will reinfect. Again, your physician will be able to provide you with information. Over the past decade, we have been fortunate to have 2 new medicines approved in the U.S. for the treatment of Sjogren's. One is pilocarpine and one is sivamycin. These are both very helpful in the treatment of dry mouth, but they must be used according to directions by your physician. The second major part of Sjogren's is what we call extraglandular features. In other words, the glands are the eyes and the mouth, but there are also glands in the skin that are dry, and also glands down in the vagina, which again is a huge issue to many women. And again, there are special treatments that you should discuss with your physician. Many patients are hesitant to mention these issues with their clinician, and they should not, because Sjogren's is a quality of life disease. Sometimes the physician may only concentrate on life-threatening issues such as blood pressure, but you must take the initiative to improve your quality of life by raising these issues with them. I know that in the U.S. many patients are hesitant, so in this video we hope to give you permission to raise these issues for your quality of life. The medications that we use in Sjogren's are very similar to the medications that we use in systemic lupus. We use medications such as hydroxychloroquine, often methotrexate, often leflunomide. These are medications, as well as mycophenolic acid, that are available in Taiwan. Again, whether these are appropriate for you will be a decision for your physician. Even though Sjogren's is an extremely common disease, it has a frequently similar to lupus in the general population. It is important that many physicians in the busy emergency room do not understand or recognize Sjogren's syndrome. So what we tell our patients in the United States is that when we go to our rheumatologist, we discuss our case as Sjogren's. But when we go to the emergency room, we often tell them, I have a form of lupus, because this allows the physician immediately to not figure out how to spell Sjogren's, but will allow him to concentrate on your condition. So the conditions are distinct, but close enough so that when you are dealing with emergency or other relatives, rather than such a long explanation, we simply say it is similar to lupus, and the treatments, again, are similar to lupus. Finally, the third aspect that is very important to patients with Sjogren's is the fact that they will often have profound fatigue. We often see this in lupus patients and in Sjogren's patients. The frequency is much higher than the general population, and we emphasize that many studies using MRI and other kinds of testing have shown that this is not simply depression. It is very important for spouses and employers to understand that this is an imbalance of the neurochemicals that is causing the fatigue. And from your point of view, to be optimistic that there are new therapies that will improve not only your dryness, but also your energy level. Recognition of sleep patterns, the avoidance of medicines that exacerbate the dryness, such as over-the-counter sleeping medications that contain Benadryl, which will make you further dry and wake up at night and interfere with your sleep. There are aspects of diet which are important. There are the need for regular exercise. There are many ways in which, by keeping yourself physically fit, you actually improve the immune system. So the three legs for the chair for Sjogren's are topical therapy, which we now have an oral medicine. We have oral medicines which will further aid the dryness. The medicines for the rest of the body, the lung, the kidneys, the heart, and sometimes even enlarged lymph nodes that occur in Sjogren's. These medicines have a similarity to lupus and are appropriately used under the direction of your physician. And finally, one of the greatest causes of disability is the profound fatigue and the feeling of cognitive loss or cognitive confusion. We wish to emphasize that you are not getting Alzheimer's disease. This is not something where you are going to become debilitated, but it is something that is an imbalance. There are new medicines, and again, by altering your lifestyle, by altering your diet, and by a positive attitude, you can improve your quality of life. Thank you again, and greetings from our patients in the United States who we hope will become partners with you in this desire to improve our lives.